Bismillahirrahmanirrahim. This lecture is about treatment of type 2 diabetes. Management of type 2 diabetes include healthy eating, regular exercise, weight loss, possible diabetes medication or insulin therapy, and blood sugar monitoring. Healthy eating. There are no specific diabetes diet. However, it's important to center the diet around a regular schedule per meal and healthy snacks, more high fiber food such as fruit and non-starchy vegetables, pure refined grains, starchy vegetable and sweets, modest serving of low-fat dairy, low-fat meat and fish, healthy cooking oil such as olive oil or canola oil. There are 4 types of dietary fat: saturated, polyunsaturated, monounsaturated, and trans fats. Polyunsaturated and monounsaturated fats are liquid, while saturated and trans fats are solid. Fats that are liquid at room temperature, like olive oil, tends to be more beneficial for health. Solid fat like butter can negatively affect our health when eaten in excess. Monitor carbohydrate intake to keep your blood sugar level more stable. When you eat calorie you don't need, especially carbohydrate, shortly called carbs, your blood sugar level rise. Over time, regularly high blood sugar level can lead to serious long-term possible problems such as nerve, kidney, and heart damage. To help control your blood sugar level, you can make healthy food choice. Eat at regular time and keep track of your eating habit. When you eat healthy food at regular time, you train your body to use the insulin it makes or that you get from medicine better. This will help you control your blood sugar and reduce your chance of having long-term problems. Monounsaturated fat. Limited amount of monounsaturated fats such as olive and canola oil and avocado can support health, as can limited amount of polyunsaturated fats such as sesame seed and nut. Saturated fat present in coconut oil, animal fat and dairy product can increase cholesterol level, which is a risk factor for carbohydrate disease. Current dietary guideline: it should contain 40 to 65% of an adult calorie come from carbohydrate. 45 to 65% of an adult calorie come from carbohydrate. Fewer than 10% come from added sugar. 20 to 35% come from fat, with fewer than 10% of these coming from saturated fat. 10 to 35% come from protein. The plate method uses the image of a standard 9-inch diameter plate to help people neutralize nutritional balance as they plan their meal. A plate includes 50% non-starchy vegetable, 25% lean protein such as lentils, tofu, fish or snacks, or fish or skinless chicken or turkey. 25% high fiber carbohydrate such as whole grain or legumes. A person who needs a high intake of carbohydrate can add a small amount of fresh fruit or a glass of milk. The glycemic index (GI) rank food according to how quickly they raise blood sugar level. Food with high glycemic index scores increase blood sugar level rapidly. These foods include sugar and other highly processed carbs. Food with low sources contain no or few carbs or contain fibers, which the body does not absorb as quickly as processed carbs. carbohydrate-rich food and their glycemic index sources. Low glycemic index sources of 55 or less. Whole wheat bread, that is 100% stone grind, sweet potato with the skin, most fruit, whole oats. Medium glycemic index. The food which have medium glycemic index, which is up to 55 to 69. Quick oats, brown rice, whole wheat, pita bread, high glycemic index 70 and above. White bread, raised potato, candies, white rice and melon. Physical activity. Exercise is important for losing weight or maintaining a healthy weight. It also helps with managing blood sugar. Exercise is considered an important therapeutic regime for diabetes mellitus, promoting cardiovascular benefit by reducing cardiovascular risk and mortality, assisting with weight management and improve glycemic control. Increase tissue sensitivity to insulin, produce a beneficial effect on glycemic control. The goal is to get at least 150 minutes per week or moderate intensity physical activity. One way to do this is to try to fit in at least 20 to 25 minutes of activity every day. Also, on 2 or more days a week includes activity that work all major muscle groups: leg, hip, back, abdomen, chest, shoulder and arms. A UK-based study in 2004 which studied both type 1 and type 2 diabetes patients found that only 34% of patients took some form of physical activity and only 9% of these patients exercised sufficiently to achieve a large change in heart rate or breathing. Aerobic exercise. Choose an aerobic exercise that you enjoy, such as walking, swimming, biking, or running. Adults should aim to 30 minutes or more of moderate aerobic exercise on most days of the week, or at least 150 minutes a week. Resistant exercise. Resistant exercise increase your strength, balance, and ability to perform activity of daily living more easily. Resistant training include weight lifting, yoga, and calisthenics. Adults living with type 2 diabetes should aim for 2 to 3 sessions of resistant exercise each week. Limit inactivity. Breaking up long period of inactivity such as sitting at the computer can help control blood sugar level. Take a few minutes to stand, walk around, or do some light activity every 30 minutes. Weight loss. Weight loss results in better control of blood sugar level, cholesterol, triglyceride, and blood pressure after losing as little as 5% of body weight. However, the more weight you lose, the greater the benefit to your health. In some cases, losing up to 15% of body weight may be recommended. Monitoring blood sugar. Check blood sugar level to make sugar remain within target range. Check it once a day and before or after exercise. If take insulin, need to check blood sugar multiple times a day. Monitoring is usually done with a small device called a blood glucose monitor at home, which measures the amount of sugar in drop of blood. Keep a record of measurements. Continuous glucose monitoring is an electronic system that records glucose level every few minutes from a sensor placed under the skin. Information can be transmitted to a mobile device such as phone, and the system can send alerts when levels are too high or too low. Diabetes medications. If can't maintain target blood sugar level with diet and exercise, your healthcare provider may prescribe diabetes medication that help lower glucose level, or your provider may suggest insulin therapy. Medicines for type 2 diabetes includes the following. Self-medication of these medicines must be strictly avoided. Follow the instruction of your health care provider. In countries where law is on ground, they are only available on the advice of qualified healthcare provider. Self-medication is possible in countries where law is limited to pages of book. The first drug and the more commonly used drug is metformin, and it is available with the name of glucophage, glumetaz, or portamet. Is generally the first medicine prescribed for type 2 diabetes. It works mainly by lowering glucose production in the liver, exerts its glucose lowering effect by inhibiting hepatic gluconeogenesis and opposing the action of glucagon, and improve the body sensitivity to insulin so it uses insulin more effectively. Some people experience B12 deficiency and may need to take supplement. Other possible side effects which may improve over time include nausea, abdominal pain, bloating, and diarrhea. Sulfonylureas help the body to secrete more insulin. Their primary mechanism of action is to close ATP sensitive potassium channel in the beta cell plasma membrane, and so initiate a chain of events which result in insulin release. For full understanding of this mechanism, please watch my lecture Synthesis, Storage and Secretion of Insulin. Examples include glyburide, diabeta, and the most important drug in this series is glimepiride, or with the name of Amaryl, which is available in dose of 1 to 4 milligram. Possible side effects include low blood sugar and weight gain. Glinides stimulate the pancreas to secrete more insulin. They bind to the SURI, sulfonylurea receptor 1, on the beta cell, although with lower affinity the sulfonylureas, and stimulate insulin release in the same way. They are faster acting than sulfonylureas, but their effect in the body is short. Examples include ripaglinide and netglinide. Possible side effects include low blood sugar and weight gain. EMPA-GLUT2 inhibitor is the predominant transporter responsible for reabsorption of glucose from the glomerular filtrate back into the circulation. Empagliflozin and dapagliflozin are an inhibitor of GLUT2. By inhibiting GLUT2, empagliflozin and dapagliflozin reduce renal reabsorption of filtered glucose and lower the renal threshold for glucose, and thereby increase urinary glucose secretion. GLUT2 inhibitors possible side effects include vaginal yeast infection, urinary tract infection, lower blood pressure, high cholesterol, risk of gangrene, risk of bone fracture. Canagliflozin is responsible for fracture of bone, and the risk of amputation. The same drug is also responsible for the amputation and the risk of amputation. Canagliflozin. Other medication your healthcare provider might prescribe in addition to diabetes medication include blood pressure and cholesterol lowering medicines such as low dose aspirin to help prevent heart and blood vessel disease. Type 1 diabetes insulin therapy. Insulin therapy. Some people who have type 2 diabetes need insulin therapy. In the past, insulin therapy was used as a last resort, but today it may be prescribed sooner if blood sugar target aren't met with lifestyle change and other medicines. Types of insulin. Long-acting insulin is designated to work overnight or throughout the day to keep blood sugar level stable. Short-acting insulin generally is used at mealtime. Your healthcare provider will determine what type of insulin is right for you and when you should take it. Your insulin type, dosage, and schedule may change depending on how stable your blood sugar level are. Most types of insulin are taken by injection. Side effects of insulin include the risk of low blood sugar, a condition called hypoglycemia, diabetic ketoacidosis, and high triglycerides. Weight loss surgery. Weight loss surgery changes shape and function of digestive system. This surgery may help lose weight and manage type 2 diabetes and other conditions related to obesity. There are several surgical procedures. All of them help people lose weight by limiting how much food they can eat. Some procedures also limit the amount of nutrient the body can absorb. Weight loss surgery is only one part of an overall treatment plan. Treatment also include diet and nutritional supplement guidelines, exercise and mental health care. Generally, weight loss surgery may be an option for adults living with type 2 diabetes who have a body mass index BMI of 35 or high. Weight loss surgery requires a lifelong commitment to lifestyle change. Long-term side effects may include nutritional deficiencies and osteoporosis. Pregnancy and diabetes. People living with type 2 diabetes often need to change their treatment plan during pregnancy and follow a diet that controls carbohydrate. Many people need insulin therapy during pregnancy. They also may need to stop other treatments such as blood pressure medicines. There is an increased risk during pregnancy of developing a condition that affects the eye called diabetic retinopathy. In some cases, this condition may get worse during pregnancy. Thank you. Please subscribe the channel, press the bell icon for upcoming notification, like the video and write down your valuable comments in the comment box for improvement of the channel.